5:30 p.m. I am calling the Monday, December 14th meeting of the Ayer Board of Health to order. First things first, we finally are back to full strength. Steve Slasky has joined us as member. I am very pleased to say thank you once again, Steve, for volunteering your services. Steve has a great background for this. He's a registered pharmacist. He's, had some dealings not only in his professional life, with medical field, but also was on Board of Health back when your mom was on, Trish.
Oh, it was the same time?
Yeah.
Oh, wow. And Bob knew, I think she said, was the other person that she was on with.
That's correct. Yeah.
Wow.
Memories.
It's not just a small world, it's a small town.
It is a small town.
So yeah, he has some good board experience, has been on Board of Health, has been on Board of Selectmen, has, lived in town forever. So you're going to be a great asset. I can't be more happy that you have joined us.
All right.
So public input, do we have any public input other than the East Main Street Mimi's place, because that has its own item, but any general public input about anything?
I don't hear anybody else.
Nope, I'm not hearing anything. Okay, no public input.
Nope.
So then we're going to move into this continued public hearing, and this is continued from, geez, I had to look this up. This is continued from October?
Yeah, that was the original date.
Yeah. So just to kind of refresh everyone, including myself, Steve Wenzel has purchased the property that we all know and love as the Casa Manor Motel to be operated as Mimi's Place, and had sent in an application for motel license, and we had a public hearing on that was started back in October, asked for some additional information. And so this is the next step. This is the continuation of that. So I'm going to turn it over to Bridget, because I know that Bridget has been in more direct contact with Mr. Wenzel and has been reviewing the document. So that's okay with you, Bridget.
Pam, can I ask a quick question? Steve has had access to these past minutes, and I mean, he's been caught up to speed where we are with this.
I talked to Steve.
Okay.
I believe it was last week.
Okay.
How do you feel, Steve? Do you feel like you're sort of up to speed?
Let's say I'm coming up to speed. So
Okay. Sure. Yeah, I gotcha.
I think I have all the documents. I got one this afternoon that was, I guess, Steve's response. So I have that.
Yep.
And I have copies of the past. So I don't have the same amount of background that you do, but I'll come up to speed.
Okay.
Thanks.
All right, great.
And I'm sorry, Steve, I thought when you were asking first, I thought you were talking about Steve Wenzel.
I'm sorry. No, I just, no, it's all good.
Oh, we know Steve Wenzel is up to speed on this.
Okay.
He's like the main actor, the main character in the play.
Okay. All right.
Is Steve there, Wenzel? Did he?
He's muted.
I see you're on, but you're muted.
Yep, Steve.
Okay. I just wanted to make sure he was here. So essentially, Steve has submitted a bunch of documents. Everything that I have up to date, I sent to Heather, and she forwarded to you guys. And so essentially what my recommendation is at this point is to continue this hearing, because based on the information that we have, and the people that are staying at the Casa Manor, they this could also be considered a rooming house. So it's acting as a hotel / motel, have you, but it's also a rooming house based on, the time people are staying there. And a rooming house needs to meet the definition. So they need to meet the requirements in the housing code, but there's also a bylaw in town that Steve Wenzel needs to be in compliance with. So we're going to actually need to get some assistance from council, which I've requested today. And I have not talked to town council yet with the building inspector. So until we have that information and we have that meeting, I suggest that the hearing is postponed to the next meeting.
Okay. I think the only thing that makes sense to me is, since we did receive some additional information, if there's anything that anyone participating in this meeting wants to ask or add information that you want to add or comment. Yeah, otherwise, I think it does make sense to continue.
Mhm.
So any other input from anyone out there?
No, it makes sense. Makes sense. Is Mr. Wenzel doesn't have any comment. He's still muted.
Yeah, I know. And we've got,
I'm gonna ask
I
him.
see Chief Johnson is with us too. Is there anything new or different that you'd like to add from fire department perspective?
I can just add on to what Bridget said. I know Bridget, the building inspector and the fire prevention lieutenant have worked collectively together, and nothing changed on our end from last time we spoke. They were waiting word on the design professional for the fire alarm stuff, and actually nothing changed. At least for now, he doesn't have to do anything. So like Bridget said, I think you have to wait till you get the what they actually want to say that that's going to be used for, then you'll have some better guidance. Because if
Makes sense.
if the use changes, it may or may not change. So I think before we go ahead, we'll see what the actual use is going to be considered before we have a final determination.
Okay, that makes sense to me.
Pam,
So, I'm sorry, go ahead.
this is Steve. Like I said, I'm trying to get up to speed on this, but I noticed that the stuff that was sent over this afternoon is pretty dated. Is there any updated information that Mr. Wenzel can provide in terms of the question Nishoba had asked?
So the information, and that's a good point. The information that is current is the list of tenants. There's obviously not names given, but the number of people staying in the units, that's current. And then the drawings that he hand drew those based on, I think, measurements that he took probably over the past month in each unit. So the policies and procedures, those are outdated. And that was, a question and concern that I had, that, is he going to address that and change those? But again, I think once we get the answer from town council, we can kind of address that next. But like I said, the drawings and stuff were done fairly recently.
Okay.
And that was a question I had for Charlie. There has to be, Steve, you know how old this Casa Manor is. It goes way back to I'm assuming the 60s. There must be a copy of a blueprint or something that shows the original structure instead of relying on drawings, or somebody must have something.
I don't think there's anything.
Really?
Wow.
Yep.
Huh.
When did that first go into operation? Does anybody know or recall?
I'm assuming the 60s. I remember it as a kid driving down.
Yeah, I mean, it's been there as long as I can remember.
And there was a swimming pool there.
Yeah.
What I can do is I can ask Charlie, even Heather, if we could just, is there a file on it that would, something that we're missing that would,
Yeah.
to see if there was, anything that was submitted. Again, based on the age, I'm not sure what was required back then to be submitted.
When I looked at the email that came over, the name Grayton, the previous owners, rang a bell. There was I think their son went to school at Ayer High for a couple of years, and he palled around with my son for a little while. So when I saw it, I went, oh, okay, I remember that name. And I don't know how long the Graytons owned it, but I think it was 2002 was one of those
Yes.
forms in the email. I don't know if that was when they bought it. No, it couldn't have been. It must have been. So I don't know. They must have had something for reference. Why would you buy something like that and not have blueprints or something? I don't know how that works, but I'm just curious.
Yeah, I think it makes sense to look in the files at least with building inspector to see if there's anything there.
Yeah, I can look in the files and see if I can find anything. Usually if I can't find anything, I usually pull the assessor's records, the property card, and it gives a layout. But I mean, again, that's not 100%. It's just a guess.
How far back can you go with that, Heather?
It depends on how the property, to be honest. I mean, we request for the McDonald's, and that went back to 1990. Sometimes they go back to the 70s, but anything after 70 before zoning, you're not going to get.
Okay.
You have a hard time getting anything because it predates zoning if it goes later.
Okay.
Okay.
So those were all done, with the handshake and a napkin passed back and forth. So it depends on anything prior to like depending on the town, 80s, 90s, you're lucky if you get anything.
Yeah. Okay. Gotcha.
Well,
I know. I forget how recently we put in zoning. Really.
Yeah. Most towns are in the 70s that they did zoning. So anything predating that is hard to find.
Yeah. Yeah. I gotcha.
Septic files go back a lot further usually than the building files will go.
Yeah. Yeah. I gotcha.
All right. Just to kind of circle back around too. So I keep forgetting, Steve, you weren't here for the last meeting. So that we had asked for a list of items from Steve Wenzel, including drawings of the units, and the number of people in the units, and also the number of units that people have been staying there over 60 days. So that information is the most current. That's from those hand-drawn sketches are the most current that he just submitted to us in response to those questions. Some of the other questions that I asked, like I said, in regards to, weekly rates and policies and procedures, he has none in place for himself. So I just said, if you're using the old owner's things, just give me that to go by for now.
Sure.
So we can kind of look at that. But which is why some of it is really old.
Yep. Okay. So is he operating now under the former license? Is that what he's operating under, or transition or something like that?
So basically he doesn't have a license. And again, if he's not operating as a hotel or motel, then he wouldn't get a license because that's not what he's operating as. And then that's where it sort of bumps to, there's a town bylaw that prohibits some things, and that's where we're working on. That's what we're working on with town council. And then the other piece of it is if he did transition into something like rooming houses or rooming units, he needs to have those units be in compliance with the state housing code. So for example, if you have a unit that's 270 square feet, you can't have 5 people living there, or 4 people, or 3 people living there. And that's not something that the Board of Health could give a variance to either. And that's sort of some of the issues that we're having, is that even though his tenants haven't complained, these places are possibly too small for the number of people living there.
Sure.
Yeah, I got you. I got you.
Yeah,
Did
there
you-
was 2 units there, 1A and 9A. There were 4 people in one and 5 people in the other.
Yeah, yeah. It seemed kind of tight. Yeah.
Hey, Bridget, I had a follow-up question, if you don't mind. On the,
Yeah, sure.
from the housing code, does anything indicate they would need some kind of fire alarm, like even a smoke detector, or where right now where there's no enforcement, but under the housing code, does that request
So
anything?
I mean, they need the typical, they need obviously the smoke detector and the CO detector,
Yep.
but then it bumps to the fire
Okay, yeah, so we'll
department.
just wait and see
So
what, we'll just wait and see what town council said, and then maybe with there's some enforcement from the housing side if they were to proceed forward.
correct.
Okay, perfect.
Okay.
I've got one other question. This is Steve. Is there
Yeah.
currently an occupancy permit that's been issued for that area? Or is this pre-occupancy permits?
Are they grandfathered in since the sale? I mean, whoever was staying there at the time is just,
If you remember, we asked Steve who was staying there, and I'm pretty sure, if my memory serves me correctly, he didn't even know who some of the people were that were living there and how long they were there. I think that was part of the issue too.
right.
Yeah, that's what I remember too.
Yeah.
So, Mr.
So
Wenzel,
as far as
not
occupancy goes,
go ahead, Bridget, I'm sorry.
as far as the question about occupancy, so anything that requires a certificate of occupancy, that usually that comes, if I am, again, I'm not 100% certain, but I think that would require something from the building department. But I don't know that this would require occupancy
Hello?
permit.
Hello?
Okay.
He's on.
So
Yeah.
once again, technology has not been kind to me. I got into the meeting. I can see and hear you guys, but I'm on my phone, and it's unbelievable. But so I
Yeah.
feel bad because I think I could have answered some of the questions, and now I don't remember them all. So, but I know that I was told that that it was built probably somewhere in the 50s.
50s.
Yeah,
That could be.
1950s.
Could
Okay.
be.
I remember that was one of the questions you asked.
Yeah.
Yeah, I think the Lieutenant Bozak, he's been very patient with me trying to get the fire alarm system figured out. I've got something in place. It just seems like it's taken forever to get to that point. Hopefully it gets there. I know you mentioned a couple of the units, the ones with the most people in them.
Mm-hmm.
Again, these are people that I inherited, and both are looking for places. And I think everybody can appreciate the cost of apartments and things. It's just not easy to find them.
Right.
So, like since I've been there, I haven't rented to more than 2 people, and I feel that in most cases is the max for some of these units.
Yeah.
There's a few bigger units where you could maybe go a little bit more, but they're not really designed for that. So
Yeah.
What was the other, now that I didn't write it down.
Yeah.
I was curious as to the age of it, and there was another, the occupancy. Steve Solarski had asked about that. When you purchased it.
the occupancy permit.
Yeah.
Yeah.
Is that?
Yeah.
Yeah. So my understanding from Charlie is he's waiting for this board to make the determinations before he gives me an occupancy permit.
Oh.
Okay.
Have you applied for an occupancy permit, Steve?
I believe I have, but I think this is like a prerequisite or a precursor to that.
Okay. Is there any occupancy permit on file then from prior to the sale?
Prior, yes, I believe, well, is there? I don't know. I have to think about that, but I would assume there must be something.
Okay.
I know he updates, they updated something at the Board of Health every year. They'd have to come in and fill out a form.
So that's the same thing that you did, which was they renewed their hotel motel license.
Yep.
So is there
Right.
is there Bridget, is there a limit on time between the purchase of a property and getting that permit? I mean, there's already people staying there, so like, I don't know what the term is, not grandfathered in, but people are there, but the
Yeah.
occupancy permit isn't in Mr. Wenzel's name yet.
So again, this is sort of what we're trying to determine is he's not fully operating as a hotel at this point. So that's what I have to talk to town council about. I mean, I don't know what we can do at this point. Just the people are already living there, and
Yeah.
I don't know that. This is a first for me as well. Again, this kind of came to light after the fact, but if he's operating as a rooming house, then the board can't really issue him a permit for a hotel motel because that's not what he is. And that's, again, what we have to sort of determine. And that's where he would have to be in full compliance with the housing code as well. And that's something, again, that, just we're looking at with town council, because the people that are living there, again, it's not like the board can issue a variance for the square footage of space.
Yeah.
So one thing that we discussed at the last meeting was perhaps going to the ZBA and asking for some type of extended stay type of motel where people are allowed to stay longer. I don't know if that's a possibility where, I don't know, maybe I could get a conditional approval as a motel pending getting the variance agreed to or something.
So like I said, I just advise that we wait till town council kind of circles back in on this.
Yeah, I
because,
see what you're saying.
again, right now he's not acting as a hotel.
Well, I disagree. I am.
Fully.
Okay.
You're not fully acting as a host.
Yeah.
Correct.
Yeah.
Okay.
So there would be at some point, the board could possibly issue a hotel motel license at some point with conditions on it to protect the board.
Mhm.
But again, that's where I just, I feel like we really need to talk to town council.
Sounds
Okay.
like, do we have any time frame that we're looking at to bring this to whatever endpoint it's going to get to?
My hope is,
Good question.
so I called council today and requested, a meeting with Charlie. It would be Charlie, Bob Oziak from the fire department, as well as myself, just to go over all the issues. And then, whenever the next Board of Health meeting is, I would hope would have enough information for the board to make a decision and, move forward.
Sounds good to
Okay.
me.
Yeah, that's what I was wondering too, Bridget. I know I sent it out a little late, like 20 minutes before the meeting, but I did send out a list with suggested 2021 Board of Health meeting dates. And our two standard dates for January would be the 11th and the 25th.
So that it's totally up to the board when they would want to continue this to. The only thing, of course, that we're battling through right now is obviously the holidays.
Yes.
So,
Yeah.
It's completely up to you. Like I said, I already
Yeah.
made the request to council. I'm hoping to have a meeting either next week or, the latest the week after. So theoretically, January 11th isn't out of the realm of possibility.
Okay. Then I suggest that we take that date, continue it until January 11th. And if for some reason we're missing some critical piece of information, then the backup date would be, we could postpone the continuation till the 25th. Is that okay with everyone?
So not the 11th, the 25th.
No, I'm saying let's shoot for the 11th. Let's continue it until the 11th. And
Okay,
then if, we just don't have enough information from whomever, town council, whomever, to be able to act on it, then we would have to just postpone it again until the 25th.
okay.
But I think if there's a chance that we might have the information, I'd rather do this sooner than later.
Yeah,
Okay.
because I agree, it's
And right, it
nothing-
seems
there's
unsettled.
nothing, yeah, there's nothing in writing. It's like free floating. We don't have a time
I know.
frame. We don't have a,
I
a
know.
date where things end and begin and all that. So, yeah, so put it
Yeah.
back on the agenda for the 11th.
Yeah, that's what I would say. Do we have to vote, Heather?
Yeah, you have to vote to continue the hearing, yes.
Okay.
For the date, the 11th.
Then, thank goodness for Heather. So I will make a motion that we continue the public hearing on what is now has signage as Casamana, but is really Mimi's place, until the January 11th meeting of Board of Health.
I second.
All right, all in favor?
Aye.
Aye.
Okay, we got it.
Okay.
So we will plan to see everyone involved again on the 11th, and yeah, hopefully we will get information, because like you say, it's unsettled. These are people living there, so I hope we can get it wrapped up.
Are we expecting more information from Charlie, from a building inspector, or where he's been in touch with
Sure.
Chief Johnson and Bridget? Should we invite him to that meeting? Unless you feel, Bridget, that you have enough information and Chief Johnson feels that he has enough information.
So I think the next step, I always think it's good to have, as many people as possible to discuss it that are involved. So I definitely don't think it's a bad idea. It really at this point is going to come down to what town council, determines as far as what's going on there and how to proceed with the town.
Yeah.
Okay.
And I would agree with that. Like Bridget says, we got to wait to get the other parts of the puzzle before we can make a determination.
Yes, and we'll make sure that everyone who has an interest and has input in this knows if it's, so everyone on this call certainly is invited on the 11th. I know Bridget can pass that along to Charlie. And if it does have to get postponed till the 25th, I'll just make sure everybody knows so that you don't call in on the 11th for no reason.
Okay.
All right.
Good to know.
Okay.
What time on the 11th?
5:30.
Okay. Thank you.
All right. Thank you.
Thank you.
Thank you.
Oh, Bridget, tell us some COVID stories.
Oh,
Is that how we're putting
do
it
you
now,
really-
Pam? COVID stories.
do you really want to
Yeah.
hear it? Do you really want to hear them?
In a gruesome kind of way, yeah.
Yep.
I know it's never
So as you
good,
know,
but, ugh,
air went red.
I know.
Which, in the scheme of things, the Neshoba Board of Health, we cover or we serve, I forget, I don't even know. I think it's 17 towns now or
I think it's
15 or
17.
something like that.
You're right.
Yeah. And so we're used to the red. I'm very used to the red.
Mhm.
So to me, it's sort of like, it's just, I guess I'm numb.
Yeah.
But the reality of the situation is just, I did talk to Tamara today, who is our town nurse, and it's just, I'm not going to lie, it's very depressing because the numbers are going up and because so many people have been diagnosed, positively with COVID. You start to see the spectrum of people sick change, and it's affecting people of all different ages. Tamara said last week, a lot of 1-year-old, 2-year-old kids, it's affecting a lot of daycare operations. And what is happening is it goes from, once one family member has it, it generally runs through the entire house. And, again, we're starting to see the hospitals fill up, and people are not able to get to their regular appointments at the hospital. And, it's just now that the backlash is, you're just seeing all of these things sort of trickle down, and it is affecting, obviously the restaurant world. I had several restaurants call me today, and, a lot of it is guiding the employers through the process of, how to have people quarantine, who needs to quarantine for how long. Just when you memorize the standards, they change. And that's what happened last week. And, I think it's important to note that people are getting tested because they're not feeling well. And there's different levels of that. And people, affects, like I said, you can have a family of 5, but it affects every one of them different. And, you can have one that it's really bad, some that they don't really have many symptoms. But I personally can say that we started really, amping up our inspections as much as possible. It's hard to get out of the office because we have so many phone calls, and, we try to guide people through it. But what we're finding during these inspections is, people a lot of times say that, I had one lady tell me that her son had no symptoms, but then as I talked to her, he lost his sense of smell and taste. And it's like, well, that was a symptom. And I think it's hard for people to understand that. And, it's the sense of smell, loss of taste is probably the most prevalent symptom, but people just overall aren't feeling well. And then there's some, even very young people not being able to breathe. And the description that they give is that they can't even walk up a flight of stairs. And it goes well beyond any flu that they've ever had. That's not the case for every single person that has it. But again, the more people that are diagnosed positive and the more cases there are, the range now is shifting, and it's affecting all ages, it's just very sad.
So Bridget, are you getting more the numbers, higher numbers now on children?
Yes.
Are you getting? Is the data showing that?
Yes. The average age of a few weeks ago, the average age was, I think, somewhere, but it floated between like maybe 12 and 14 to 28. But now there's been a big shift. And Tamara said the past couple of weeks for her, and it's specific for this particular area, have really been in the daycares. And there's a lot of younger kids. And I as much as I can, have helped with some of the contact tracing, and that's, it's not uncommon to see the age range of 1, 2, 3, 4.
And are those kids, are their symptoms as severe as the other populations that
so
are getting?
Tamara said that the with the kids, because I did ask her this, with the younger kids, the symptoms seem to be more like the common cold. And they kind of barrel through it better than their parents. So we've had some that, from 35 to 45, where they cannot even get out of bed. And they, the description that I've heard from people is that it's literally, you can't get out of bed, and you can't make it up a flight of stairs, and extreme exhaustion goes along with it as well.
Wow.
That's what a friend of mine described exactly. She and her husband had it.
Mm-hmm.
She said she doesn't even remember certain days. And she
Yeah,
had
and
the COVID dreams, all kinds of weird
Oh,
stuff.
jeez.
yeah, I mean, it's
Yeah.
like I said, it varies from person to person, but that was the other thing that we're seeing more of now, and I think it's more with 30 somethings and up, is double pneumonia is something really.
Ah!
They're in addition to the COVID they get, that they're having double pneumonia, and that in itself is scary.
Yeah.
And so it's just, the one thing that we're trying to do too is just, and I don't want to take up too much time. That's why once I start talking, it's very difficult to stop. But we have been, especially in Ayer, getting more complaints from people about people outside not wearing masks. And so we've kind of ramped up, we asked to have the signboards, reflect wear a mask inside and outside in public spaces. I think it's important. We don't see, if you don't mind, can I just talk for 5 more minutes and then I promise I'll stop?
Go right
Okay.
ahead.
That's why you're here.
Yeah.
Okay. So there's a couple of things that I think it's important to really kind of get across to people is, so the inside outside thing, there are people that you can get COVID outside. We've had people that run together and walk together, and they get it from each other that way. If think about it, you're expelling right into the person next to you. And if you're walking or running for 45 minutes, again, it's not as common, but it does happen. And, I try to stay off social media, especially in regards to this stuff.
Yeah.
But I've heard, you've seen the things that you can eat inside, or you can't eat inside, but you can eat outside inside with those, and they show the pictures of the tents and all that stuff. You have to have a certain, I believe it's at least, at one point you had to have 2 sides of a tent open. I think they might have gone down to one side. You have to leave at least one side fully open on the tent. And again, that's for the air circulation. And that's the difference between inside and outside. With those tents, they're not supposed to be completely closed. Right. You can't. It has to be one. Like I said, I'm not sure if it's one side or both or 2 sides. And then the other thing that keeps, and then the other thing that keeps coming up is, inside, why do you have to, now you have to wear your mask except when you're taking, basically, I think it's taking bites and stuff like that and drinking. So you kind of have to put the mask on in between. But going to the bathroom and walking through the establishment, why do you have to wear a mask? Because essentially that mask is on some level protecting the people around you and reducing the viral load. So as you're walking around freely without the mask, you're expelling into the air. And again, the mask just helps reduce that. So I think it's important to understand that's why you have to wear it inside. And it's all based on air circulation. We keep trying to tell people, if you have people at home that are sick, you're supposed to be staying away from each other, using separate bathrooms, and we're encouraging people, open your windows and circulate the air in the house.
Yeah. I know we're wearing jackets at school. The windows are open.
Yeah, I mean.
Oh, really?
Yeah.
Wow.
It's freezing.
Well, I was ahead of the curve on that. I like a window open all year round. I like my fresh air.
And I mean that it's really important, especially now with just trying to, carpooling, and we're just trying to let people know that is sort of the main thing that we have really seen with this is that it's extremely contagious.
Wow. So it's not losing any steam, huh?
Steve, you're muted.
No.
Okay. Is that better?
Yeah.
Bridget, when you look at the numbers, is Ayer just people that live in the town of Ayer? Is it including Devons or any other facilities that are quasi in the town of Ayer?
So it includes, the Ayer numbers include, I think it's part of the federal prison.
Okay.
You know, in Ayer. The other thing, and I did ask Tamara this today, the number for Ayer also does include, I think it's Apple Valley and Neshoba Park.
Yeah.
So those are residents. So if they, you know, that could be a component of why Ayer went into the red. But, you know, kind of keeping in mind too, like I said, so that I don't think the prison's as much right now as the assisted living facility and the nursing home. I think there might be a couple from the prison, a few, but, you know, it's important to understand too, if you have, and it's like 5 families of 5 and they all get it. That's 25 right there in a week that can happen.
Yeah.
And that can be enough to tip you. But I think part of Ayer is the assisted living facility and or Apple Valley. But I don't know, I forget if Devon's has Ayer, Shirley, and Harvard.
Right.
And I think the numbers for Devon's, depending on where the houses are, might go to the town that actually has them in the town.
Yeah.
And I don't think Devon's has had many cases, to be honest. There's just a handful maybe for residents. The businesses, anybody working in the businesses that has COVID, those people go to the town that they live in. So for example, if there's a restaurant in Ayer and 5 employees have COVID, those numbers are reflected in the town that they live in. So if they don't live in Ayer, they don't count.
Right.
Okay.
Yeah, I had no doubt about the community acquiring, the virus, but I often wondered, what the numbers meant when they say the town of Ayer, if it was populations that, are the old lines on Devon. So I appreciate the update on that.
Yeah.
Yep.
Yeah, the Devon's thing does make it interesting.
Depending on where that prison is laid out, when they split that up into different areas of, like, the kids in this part will be educated in Harvard and et cetera, and they break it up that way. Now that I think about it, where that prison is that the lines where, I mean, it's not going to go right down the middle of the prison and split up.
I think the federal prison is Ayer, and I think MCI Shirley
is in Shirley. Yeah.
Yeah, and I think I mean,
and their numbers are I know because my son works in Sousa, and last spring, that's the Supermax, they're not Supermax, the Max, they didn't have any cases. It was the minimum and the medium. And now he's telling me they're testing every week. That they're starting to slowly.
Yeah.
And that's without visitation. So it's being brought in by the staff.
Wow. Yeah.
Yeah. And I mean, and that's a problem, the same thing at assisted living facilities and nursing homes.
Right.
Some of these places have been on lockdown since March.
Yeah.
And, that's the reality that we're facing.
Yeah.
I think Neshoba Park right now, my aunt is up there, and I haven't heard anything, knock on wood, so far that they've had any cases, but I don't know. I don't know about that. I don't know about Apple Valley, but usually they would let my mother know if there's been like an outbreak where she'd have to stay in her room.
Oh,
yeah.
right.
Now
right,
they're able to stay, to go into the living room and dining room, etc.
Yeah.
So
Yeah.
I'm thinking there probably isn't any.
I haven't heard about much up there. I know Apple Valley gets a little bit tricky because it's part of a rehab as well. So you get people coming and going.
Yeah. Yeah, that's true.
Well, that's disheartening to hear that statistics have changed a little bit and they're showing a younger population.
Yeah, I mean it's like I said, that was sort of I'm kind of looking at the numbers, and it's just to see what's sort of happening. And, the past few weeks, the last two specifically, have been really tough because, the numbers, we're seeing about 50 to 60 cases a day, and that's over 300 a week. And again, it's not, other towns, as well surrounding us, they're seeing, well over 100 a week. And when you have just one town nurse working, trying to call, for one person, if you have 20 contacts, that can take 8 hours to find the close contacts. And they're just at the point now where the system isn't really working because, the staff, everywhere, they're just overwhelmed, and you can't keep up with trying to get in touch with people because there's so many people. And it's like you get through one list, and then the next family member the next day tests positive, and that's 20 more people. So if you know what I'm saying? So if you have a family of 5 and each one of those came in contact with 20 people, that's 100 people of close contacts for one family.
Right.
Crazy.
And that's,
Have you guys been able to, so it's just Tamara, they haven't been able to maybe hire
No, so
somebody?
Tamara, when I said one nurse, that's the smaller towns. We have, so there's Tamara, then we have Susan, who is another nurse. They did bring on another nurse from Neshoba Nursing Service and Hospice in our office, so that they have her. So that's 3. My director, all of us have been sort of doing some, well, not, maybe not all of us in the office, but whenever we have free time, we'll try to help with contact tracing as well. And then I think they just did some interviews last week to try and bring more people on board. But I think, it's important to note too, the Department of Public Health, they took the funding away for contact tracing.
Yeah.
Oh, man.
So, yeah. Yep.
Wow.
So we have roughly right now, we have 3 people specifically on that. And then, like I said, they're in the process of, I think they did interviews last week, and then we're sort of trying to pick up as well. And in addition, I think it's important to note, if they can't take them, the State Contact Tracing Collaborative is pulling them as well, but they're inundated as well.
Yeah.
Because, you only have so much staff on that end as well.
Yeah. Yeah, exactly.
So Bridget, I'm curious about the contact tracing and the data, because if, say, somebody from Ayer is up, they test at one of those clinics or CVS or whatever, and then they compile their numbers and they send them to each individual town. But if you're releasing the numbers weekly, are all these testing centers on the same page as far as the time frame and the deadlines to have these numbers in? Like, I guess what I'm asking is, do they all release the data or send their data to each town on the same day? So it's a true picture of.
So that basically, if you test positive, the number that information goes into, it's reported through Maven, and so everybody is different depending on the test, how inundated they are. But once the test comes back positive, that information goes into Maven, and then that's where the nurses pick it up. So it's sort of like it goes when you get tested, it gets entered into Maven, and then our nurses print them out every morning. So it really, again, it varies, I think, test site to test site, how backed up they are, what's going on, Yeah. But it goes, once those results are given, it goes, I don't know who enters them into Maven, but it goes from that positive result is then entered into a database. It's usually, they can pick up the positive. I think it goes into the computer, and it could be, there's sometimes a couple of day lag,
That's what I was asking. Yeah.
Yeah.
Okay.
But the person that tests positive, they're called.
Right.
So they obviously know before we do.
Yeah.
I think very rarely are we surprising somebody by telling them they're positive. They
Yeah.
get the results, and then what happens is they're contacted by someone, whether it be our nurses or the contact tracing collaborative.
Right. Okay. Thank
Yeah,
you.
got it. Well, that was depressing.
Sorry.
Yeah. Oh, geez. Well, I'm just thinking that, you had predicted that we were going to have an uptick after Thanksgiving, and here we are, and now we're heading into another set of holidays, and I'm sure that'll, the fallout will come in January.
I'm sure.
We're hoping that people understand it's not, and I'm saying this from, obviously living it for 9 months now.
Yep.
It's here. It's real. And I think what's happening is this wave has been the worst since it started. And I think that it hit enough people that I'm hoping they understand that everything that they do, it might not impact you, but you can pass it on to somebody and they don't deal with it, or their body just does not respond to it for whatever reason. Like I said, we have seen very healthy young individuals be completely sidelined, and some of them are well beyond 2 weeks. They're into a month, and we have had people now, again, we're 9 months into this. So what are we seeing? The residual effects are that people are having symptoms well beyond, they're not considered contagious anymore, but the fatigue is with them for months after, the cough is with them for months after. Some people that had it mild, it kind of, some other weird symptoms start to come up. So it's the long-term effects are that it is impacting people of all ages. And it's, like I said, some of the side effects kind of fade out and then they come back. And some people, people have asked me with this the weird thing is there's no rhyme or reason to it. We have talked to people that have lost their sense of smell for just a couple of days, and some people 9 months later that don't have it still. It's weird. It's, or they have it, but it's not, they're not fully restored. So it's just bizarre.
I guess.
This virus must be just having a blast. I mean, it's just found itself a home, and this totally unprepared species, and it's doing what viruses were built to do.
Right.
Look at it from their perspective. Their whole purpose is to pass along their genetic material to someone else. So yeah, the virus is not your friend, that's for sure.
No.
Okay. Well, like I said, depressing, but true. And, I really appreciate everything that you, Bridget, and everyone else at Michelle is doing for us, because this would have been a very, very, very dark year without you. So,
well, thank you.
It has meant a lot to the town of Ayer and this Board of Health, and I'm sure to probably all your towns. So,
a lot of work.
Well, I mean, like I said, we're here just to, protect public health and just, get the message out to get people to understand that it is definitely not fake. It is definitely here, and it's definitely affecting people of all ages. And the only way to really kind of get through this, and I tell people, there's things that you can do. It's not like you have to be locked up inside. We're not seeing it spread where people are wearing masks. I think it's really important to note that. I've said it before. It's, having asthma, it makes me wearing a mask for me can be very difficult at times,
Yeah.
but I wear it. I feel much safer doing it, but you know, do I hate it? Yeah. Like everybody else, of
Yeah.
course it's like it, but we're not seeing the spread where people are wearing the masks. It's where they're not wearing the mask. So at work, if they're taking the mask off, you know, in
Yeah.
break rooms and they're, you know, going out, this is another thing. If people are going out to walk together or they're
Yeah.
having, you know, lunch together, stuff like that, that's where you can kind of see the spread start. Then you go home
Yeah.
and then the family gets it. No one's
Yeah.
wearing masks there, you know, of course. So that sort of, and, you know, that's where we're seeing it there. But then with the daycares, it's the same thing. Trying to get young kids to wear a mask is very difficult.
Oh, I
So,
know. Huh.
you know, you have a 2-year-old and, you know, they don't
Right.
understand.
Right.
So it's very difficult there, which is why I think we're seeing the spread happen there. So the 2-year-olds go home and then they give it to their entire family. You can't, it's not like you can separate yourself. So if you're adults, you can quarantine in your own house, open your
Yeah.
windows and not see each other for 2 weeks.
Yep.
Theoretically, you just,
Yeah.
you keep the doors closed. Everybody goes to the kitchen at different times. You clean. But when you have a 2-year-old that has it, the parents can't separate from
Right.
that child. So the
Right.
child gets it, then the parents get it. If there's other kids in the house, they get it.
Yeah.
And that's sort of the pattern that we're seeing right now.
Yeah. Good point. What are you seeing at school, Trish?
It's the whole, I don't know, maybe Bridget can clear this up for me. The kids you get a phone call in the middle of the day and they say so-and-so's parent just called and the parent tested positive. So they have to go into the classroom, remove the child, and then the other kids, because we're only doing half cohorts, we're only doing 11 or 12 kids in a class. We're not doing full
Okay.
classrooms.
Yeah.
So they can spread them out. And
Yeah.
we've had a couple of grades just all in the middle of the day, pack up and leave, call the parents because they've been close contact to that one child whose parents
Got it.
tested positive. But they take their masks off to eat lunch. Even though they're
Right.
Right. Yeah.
even though they're 6 feet apart, the desks are 6 feet apart, they're still talking, they're eating,
Yeah.
so yeah, we've had a couple of classes, whole classes just in the middle of the day taken out.
Wow.
Yep. And I tell people this too. Keep in mind, a close contact is 6 feet, 15 minutes, mask or no mask. So as long as the kids are 6 feet apart, they're not, a lot of times the precaution is just to kind of remove that cohort, I think. Am I right on that, Trish? And then, yeah. And so those kids technically, you know, if you're not within 6 feet for 15 minutes, that's not a close contact.
Right.
Yeah.
So, but
much
for the schools, yeah, they do it to be safe, which, you know, of course, that's the right thing to do.
Mhm.
But we're not seeing it spread from, you know, classroom to classroom or kid to kid through the school. It's
Right.
sort of what's happening outside the school, which is, we try to give some people a level of comfort in that. It's the same thing with supermarkets and, you know, the malls and stuff. It's like, if you're going in and you're going in quick, just keep your distance from people.
Right.
And you're not.
You can. But I don't understand there were two the other day. There was a cohort that was removed. 2 classroom assistants were sent home. They tested negative, but they still have to stay out the full 2 weeks.
So now they changed that. I'm going to you really want to get confused?
No, I'm already
Sure.
confused.
Let's go for it.
Yeah.
So so if you're a close contact, you can go back to work on the 8th day if you test negative 5 days or after your contact with the person that tested positive. So if you test positive, if you know someone that tested positive and you're identified as a close contact, on day 5 or later, if you test negative, you can go back on day 8 as long as you have no symptoms. So
Okay.
that just changed with the CDC changed, and then Massachusetts changed.
And that
So
was like,
all of that
wasn't
info.
last week, something like that.
Yeah. Yep.
Because,
And
Yeah.
then
yeah, but these two people that I know of aren't coming back till the 21st. That will be the full 2 weeks,
Huh.
yeah.
even though they've
So if
submitted negative tests.
Did they submitted negative tests?
Yep.
Wow.
Yeah,
3
and
days
in some
after.
places,
Hmm.
I don't know.
so that it did change, and there's all that stuff on mass.gov that goes over it all.
Yeah.
Hmm.
I understand the caution. I totally get it, especially now that you're telling us that there are kids that are getting it and getting really sick, where before we were under the impression the younger the better, you know?
Yeah.
Yep.
Yeah. Right.
Guess not.
Well, and maybe still in terms of what it does to the child's body,
Mm.
maybe they still will or are experiencing less serious, say long-term effects,
like-
but clearly it's
yeah.
spreading in them.
Yeah.
Oh yeah, I mean, like I said, with the kids, it tends to be more the common cold, Tamara said,
Yeah.
where in then sort of into the 30s, 40s and up, they're
Yeah.
starting to see that double pneumonia, fatigue,
Yeah.
just
Yeah.
some crazy stuff. But again, the kids do tend to recover quicker. But
Yeah.
again, it's sometimes there's no rhyme or reason. We have people that are extremely healthy, and it just knocks them
Yeah.
out.
Yeah.
Yeah, actually, one of the fittest, healthiest, best diet, best exercise regime people I know that had just got it.
Yeah.
Yeah.
And that floored me. It's like, if it can take him down, this could wipe me out.
Yeah.
Well, I think that's part of the reason I get so scared is because the more
Yeah.
people, you know what I'm saying? The more you're out there and the more you're talking to people and the more
Yeah.
they're telling you their experiences, it's kind of, I'm not going to lie. I mean, sometimes I get in my car and I'm like, oh my God, am I, what's going to happen? And,
Yeah.
you think to yourself, am I going to respond to it the same way?
Mhm.
Yeah.
I know. I worry a lot about you, Bridget, because you're out there on the front lines and you have to interact with a lot of people. So I always am keeping a good thought in my mind for you because you worry me.
Yeah, well, I appreciate it. And I keep a tape measure with me now to make sure people are 6 feet away.
Perfect.
Well, human nature is they see you and they want to talk to you, and it's like they'll come right up to you, and it's like, there's been a few times where I've been backed into a corner. I'm like, can we just maybe take it outside? But but there is a light at the end of the tunnel. I mean, I think that's the important thing, is that as time goes on, we're learning more, we're figuring this out, but it's just getting people to understand we all need to work together.
Right. And it's not over yet. Even though we're all tired of it, it's not over yet.
Exactly. And everybody is tired of it.
Absolutely.
Hey, Bridget, has there been any conversation at the Neshoba level on the vaccine yet, or is it still premature to think it's
so
down
it's
this
funny
far?
you asked that, Steve, because I poor Tamara has to listen to me. The problem with the vaccine is that she's saying the second quarter of next year for first responders and stuff like that being like, obviously nurses, doctors, like that whole group, people that live in assisted living facilities and nursing home, that whole group, they're the first. So everybody after that, and what Tamara said is that the problem with the vaccine is that it's required to be stored at sub-zero temperatures, and we don't have that equipment. So it's not, we're not on right now. It doesn't look like it will be happening on our level. It will be through facilities that have the ability to store this product.
Yeah.
Might be through pharmacies, things like that. And then, like I said, I think she said around maybe March or April next year, start to see the next phase come in after the nurses, doctors, nursing homes, assisted living facilities.
Yeah.
So she's thinking, and again, it's preemptive. We're just, what is our sort of feel from what's happening? That's the sort of feel.
Yeah. Is the vaccine that our frontline workers are starting off on, is it, I was under the impression there were 5 different companies, and like you said, one of them had to be stored at like 0 degrees. But some of the other ones weren't.
I think they're all.
Are they all that way?
It's minus 97 degrees.
Oh gosh.
Sub-zero, and I think that's the problem, and I think that's, I can't say for sure. Most of them I think are that way, and then I don't want to say all, but then the next level is they require more than 1 dose.
Yeah.
I think it's three. My sister's a nurse, and she said she was getting it. They were bringing it to her hospital by the end of this week. They were supposed to start, and then she thought that it was 3 to 4 weeks apart. And after the first dose, you're only 50% covered.
Yeah.
And then you have to get the next dose in a couple of weeks. So I don't know if that's true for all.
I heard one is 3 weeks and one is four weeks. And then, like I said, as they have, new things come on board, I'm not 100% certain.
Yeah.
But, with everything, I think they're experiencing some delays as well. And, organization, it's not easy. So.
Yeah, exactly.
Hey, Bridget, I do think some of the vaccines that are in the pipeline right now may not require the same degree of refrigeration.
Steve.
There's 2 of them that are, I think, in phase. I don't know the phase trial that they're in, but they're close to applying for approval. And I know that one of them is at refrigerator temperature. So I think it will make the onus a lot easier. I have no idea what the time frame is for this, but
yeah. Isn't there? There's another
would be great.
FDA panel meeting this week, I think. This Thursday, isn't there the next vaccine in line? Or maybe I misunderstood that. I thought there was another, that FDA was having another panel meeting this week on another one of the candidates, but I could be wrong.
Oh, you mean like a Moderna, Pfizer, the different?
Yeah.
It could be. I've lost track, honestly.
I know.
Steve, do you have any knowledge of what? Now you're affiliated with the National Guard, and did I read NEMA?
yes, and actually it's DMAT, the Disaster Medical Assistance
That's
Team.
right. Yeah.
So
there's nothing filtering down at that level that I've heard on the DMAT side yet.
Okay.
If I do, I'll let you know. But I did get a good article from CDC, and I shared it. Did you get that, Bridget? The article I sent you?
I did. Thank you.
Okay.
Yes.
I'd be happy to distribute it to the other members of the board if you'd like to see it.
Yeah, absolutely.
It's a fairly recent article. It's very lengthy. I think it's 50 some odd pages, but it goes through a lot of the vaccine development, storage, plans for implementation, things like that. I'll send you both copies of it.
Yeah, I know that. It sounds pretty geeky, but that actually does appeal to me.
Well, you're right. It was.
Yeah, right.
No,
That's
that'd be
okay.
great.
Geeks are okay. Oh, all right. Well, thank you very much for the update and for doing what you do every day.
Thanks.
So anything else with Neshoba? Anything going on with inspections or?
No, we're just, a lot of it is just, we were able to get all the schools done. The kitchen. So that was big. We weren't sure if the schools would close or what would happen with that. So those school inspections are all done.
Okay.
I mean, other than that,
Okay.
nothing.
Okay. Yeah, I know that's probably not the number one thing going on in Neshoba right now, but
No, I mean, it's just,
thought I'd ask.
no, I appreciate you asking it, but yeah, it's, I mean, I think the biggest thing is there's a lot of phone dialogue and email dialogue and
Mhm.
walking business owners through the whole process
Yeah.
when something happens.
Yeah. Yeah. Well, that's where your patience comes in handy, I guess. Right.
Well, if you
It's
ever want to know how to be quarantined, I can sure tell you. But
I'm going into voluntary quarantine. I'm taking the last 2 weeks of the month off, and I plan to quarantine myself in a pair of pajamas for 2 weeks. So-
that actually sounds really good.
Doesn't it? This is going to be like my best vacation ever.
Yep. But yeah.
Okay. Well, keep on doing what you're doing, kid. We need you.
Yep, thank you.
Thanks.
Okay, review and approve minutes of the 23rd. Once again, I think I did read them. I think, Heather, you did a great job again of capturing all the high points of the conversation.
Yep.
You do have, there's just a couple of typos. One of them is actually pretty funny. At the bottom of the first page, the Title V, for the Title V, the exciting system is over-designed. I personally can't get that excited about a septic system. So I think you're going to have to change that to existing. It may have been an exciting meeting, but the system itself wasn't that exciting. Oh, and then there's another one here about on page 2, they wanted a description, but that's it. So did anybody else have any more substantive changes?
I went through it very fast and I was stressing over getting that signature page to Heather. So I was kind of like buzzing through it and then just, Heather, you did get that, right? Finally?
Did you send that today? I got 2 emails from an account that had Peters as the last name, but I didn't recognize it with links, and Cindy drills it into our heads not to open them. So I was going to ask you at the meeting tonight if you indeed sent those to me before I opened them.
I did. I did because I could not get it to scan and send as I usually do. So I went through my Gmail account.
Okay.
Probably enough.
And it's an HP computer that you sent it from, a printer?
Yeah.
Okay, so then it should be fine.
Okay.
But I wanted to ask you at the meeting tonight before I opened them, just to make sure that that's where they came from. So yeah, I did get them.
Yeah, well, that's a good idea.
Thank you.
I don't blame you. So are you okay with them? If you need more time to review them, Trish, we can.
No, I'm fine with
the next meeting.
it was just a question of the whole technology piece of it. That always gets in trouble anyway, so.
Okay. So in that case, then I will make a motion that we accept and approve the minutes from the November 23rd, 2020 Board of Health meeting. All in favor? Oh, that's right.
I second it.
Okay, Trish seconded. All in favor?
Aye.
Aye.
I abstained. I wasn't there, so.
Okay, gotcha. So what I can do, Heather, is just correct those 2 little typos, and then I'll do what we've done for the other ones over the past couple of weeks. I'll sign and send to Trish.
Okay.
And then she can sign and scan. Now, we did have one thing for you. I know Trish is still having trouble opening on her older computer, I think. the agenda. So the
Okay.
Yeah,
PDF.
just the agenda.
Yeah.
Yeah, I don't get that.
Well, the only thing I noticed that could be different is that I noticed that the file extension on the agenda is .doc, not .docx.
Yep.
So I have no idea if that could make any difference, but
I
you
can
might
change
want to
it.
try, save it again as a docx and see if that makes any difference
Okay.
for next time. So
That-
other than that, that's the extent of my technical support. I'm out of ideas.
That's probably it. Thank you.
Yeah, it's worth a try.
Okay.
Okay. So I'll send you back, just so you have it then, Heather, both the corrected Word version, and then I'll PDF it with the signature.
Thank you.
Okay, great. Thank you. So mail, bills, anything?
I do have an Neshoba bill payment. I apologize if I got to scan it and send it to you to sign,
Yeah.
but I will do that tomorrow.
Okay. All right, that's fine. Any other mail that we need to get on,
I don't think so.
do anything with? Okay. All right. I did sign the permits that you sent to me, and my husband was supposed to put them in the box outside of town hall. Did you get them?
The other ones you did you send the ones I just mailed to you last week?
No.
Okay.
I don't think I
So
got
sent
those
some.
yet.
I sent some the end of last week to you.
Oh, okay.
We
They
have
might be
all-
in
yeah,
today's.
we have all but 2 of the tobacco permits have come back. I've only gotten
Okay.
4 of the trash haulers back. But I sent out second notices to everybody on Thursday, and I already gotten 2 calls back from
Okay,
2
good.
trash haulers saying that they either put it in the mail, I put it in the mail, or one was waiting to get a check from the corporate office before they sent it. So they've all
Okay.
gotten them the second time, so we should be getting those back in before the end of the month.
Okay. So how many are we, assuming that they follow through, how many then will we be outstanding?
Right now we have 4. I think we had, I want to say 12 last year, so we're missing 8.
Sounds about right. Yeah.
But I did get phone calls
Okay.
from 2 of them, so that would leave 6. So, and waste management's one of them, and I think that's the same thing as coming from a corporate office that might be taking a little while.
Yeah. Right. Yeah. Okay. All right. So do what you can, and let me know if we need to send out the, since you have decided not to do business in the town of Ayer anymore, we can send that letter if we need to too. 2021 meeting schedule, as I said, I just sent that out like 20 minutes before the meeting. So I was so dependent on Mary doing the calendar every year.
I know, with her little pocket calendar.
I know. So I took my best shot at it, and I know that this schedule avoids, I was watching out for town meeting, I was watching out for holidays, and I think we're okay, but as long as you can get the meeting for January 11th on the on the town calendar, and
Yep.
get us scheduled for the room, Heather, then we could, kind of formally affirm this. It's not like I expect you to have read it already when I just sent it out. So we can do that at the next meeting if you want. Okay, so you all have an email from me?
Yeah.
All right, great. And if I missed anything there, I know that there's spring town meeting, fall town meeting, and I seem to recall there was one other thing that Mary always tried to avoid, but I don't know what it was.
Some of the times it was because it was the water and sewer or some other board that she was on was meeting at the same time, or something overlapped that was the same.
Okay.
She liked to attend
Okay.
everything.
Well, so far, I checked the 2021 town calendar on the website, and there is nothing on Monday nights except for the 2 town meetings.
Okay.
Well, actually, no, I think only the spring town meeting. I don't even think the fall town meeting was on there yet.
Yeah.
So, but I just assumed it would be that last, the last Monday again. So anyway, so take a look. If any of these dates don't work for you, we can certainly be flexible. And I actually, you know, Trish, I had mentioned this to Steve earlier, and I realized I really should extend the same courtesy to you. Are you still good with the 5:30 start time for this meeting?
It's fine with me.
Okay.
Yeah.
Okay. I know it's kind of early by, you know, a lot of board standards, but it's nice in a way because it does allow us to be, you know, cleared out by 7-ish and.
Right, and it doesn't bother me. I was
Okay.
thinking more about you because sometimes you have overseas calls where your job
I
might.
have everyone trained. I do not do any calls on Monday nights.
Oh.
So I'm pretty good with that. It's only when I have to travel, and that's not happening for a while.
No, luckily.
So yeah, so just take a look at that. And Bridget, if I forgot, I'll look at my email. I might have forgotten to include you on this thing of dates. If I did, I will make sure that I forward you that email too.
No problem.
Okay, so I think then the action items for next meeting, we kind of have laid out for us. It's the continuation of the public hearing, and hopefully we'll be able to get to some resolution on that one quickly. We'll have another COVID update from Bridget and Neshoba update. And I think Heather, if you could, you know, just give us a count as of January 11th, where are we with tobaccos and trash haulers, and that would be good. So let's do another status check on that.
Okay. I'll actually make sure I have the numbers 100% for you too.
Yeah, I gotcha. Okay. Does anyone have anything else that you have in mind that you would like to get on the agenda? If not, if nothing occurs to you at this point, you can always email me. You know, sometime, what is the agenda actually has to be posted on Thursday morning? Is that right, Heather?
Yep, it's Thursday. It's Thursday before 5:30.
Okay. So, because I usually try to get it wrapped up like Wednesday, Thursday. So if anything comes to anyone, let me know. And
I like doing it a day before, just in case anything happens to me on Thursday. I know it's all set. I'd rather change it on Thursday if I have to than not have it posted.
Yeah, I know. It always feels, I get a little nervous cutting it close on the last day too. So, okay. So I think then we managed to cover everything on our agenda. Anybody in the mood for a motion?
Come on, Mr. Slarsky, jump in.
Yeah, come on.
Before I do that, I'll just say thank you for the warm welcome. I look forward to working with everybody. If I get any thing that's interesting on COVID or vaccinations, I'll distribute it to everyone that I.
Sure. Yeah.
Definitely.
That would be great.
Again, thanks for the warm welcome. And I'll make a motion that we adjourn.
All right.
I second it.
Okay. All in favor?
Aye.
Aye. 6:53, we are adjourned.
Okay, good night.